Are you worried about your heart or what condition it is in? You should be. Because blocked arteries send more than 500,000 Americans to the hospital every year. The medical term is atherosclerosis, where plaque builds up inside your blood vessels, choking off circulation to your heart and brain. You may have been told you need medications, or even surgery to fix it. But here's what catches most people off guard. Research from institutions like Stanford University and the Cleveland Clinic suggests certain vitamins may actually help reduce arterial plaque, and some patients have experienced measurable improvements in their cardiovascular markers when these nutrients are part of a broader health plan. The question isn't whether vitamins work, it's which ones have real science behind them, and how they might complement what your healthcare provider recommends. Let me be direct with you. When Harvard Medical School researchers examined vitamin supplementation and heart health, they found something that surprised many doctors. Vitamin K2 showed associations with reduced arterial calcification in multiple studies. But here's where it gets interesting. Most people have never even heard of K2, yet it appears to play a role in directing calcium away from your arteries and into your bones where it belongs. The researchers noted this mechanism might help explain why some populations with high K2 intake showed different cardiovascular patterns compared to Western diets. This isn't about replacing medical treatment, it's about understanding what science has actually documented regarding these nutrients. Now, what's wisdom? You might be wondering why your doctor hasn't mentioned this. The truth is that vitamin research moves slower than pharmaceutical research in clinical settings. Johns Hopkins University published findings showing that magnesium deficiency was associated with increased arterial stiffness, and when levels were optimized through diet and supplementation, some patients experienced improvements in vascular flexibility. But this is the part most people don't know. Magnesium works with vitamin D and vitamin K2 in what researchers call a synergistic relationship. Take one without the others, and you may not experience the same benefit. It's like having a key without the right lock. Let's talk about vitamin D for a moment, because the connection to heart health runs deeper than most realize. The studies linked vitamin D deficiency with increased cardiovascular incidents. Researchers observed that people with optimal vitamin D levels showed different inflammatory markers compared to those who were deficient. Inflammation drives plaque formation in your arteries, so anything that may help manage inflammation deserves attention. But here's what surprised researchers at Boston University. Vitamin D appears to influence how your body regulates calcium, and when you're deficient, calcium can end up depositing in your arterial walls instead of your bones. That's the opposite of what you want. This brings us to something you need to understand about arterial plaque. It's not just cholesterol, though that's part of the story. Plaque formation involves inflammation, oxidative stress, and calcium deposits that harden over time. This is where vitamin E enters the picture. Research from the National Institutes of Health examined vitamin E's antioxidant properties and found it may help protect LDL cholesterol from oxidation, which is often described as the first step in plaque formation. Some studies showed that when LDL cholesterol becomes oxidized, it's more likely to contribute to arterial damage. Vitamin E's role might be in preventing that oxidation before it starts. But here's where things get really interesting. Researchers discovered that not all forms of these vitamins work the same way. Take vitamin E. There are 8 different forms, but most supplements only contain one. The natural form, called D-alpha tocopherol, showed different results in studies compared to synthetic versions. Similarly, vitamin K2 has subtypes called MK4 and MK7. And research suggests MK7 may stay active in your body longer. These details matter because taking the wrong form might mean you're not getting the benefit you're hoping for. This is exactly why working alongside medical guidance becomes so important. Now, let me address what you're probably thinking. If these vitamins are so helpful, why isn't everyone taking them? The Cleveland Clinic conducted research that helps answer this. They found that some people experienced benefits from vitamin supplementation, while others saw minimal changes. The difference often came down to baseline deficiency levels, genetic factors, and overall lifestyle patterns. Someone with severe vitamin D deficiency might notice significant improvements when that's corrected, while someone with adequate levels may not see the same effect. Your individual biochemistry plays a huge role, which is another reason this works best as part of a broader health plan rather than a standalone solution. Let's talk numbers for a second, because timing and dosage matter more than most people realize. Stanford researchers noted that vitamin K2 supplementation in studies often used doses between 90 and 200 micrograms daily, taken with fat-containing meals since it's fat-soluble. Magnesium studies frequently used 300 to 400 milligrams daily, split into 2 doses. Vitamin D research often involved 2,000 to 5,000 IU daily, though some individuals needed more based on blood testing. Here's what most people miss. These aren't numbers you should just copy. What worked in a research setting with monitored participants might be different from what your body needs. Blood testing helps determine your starting point and whether you're making progress. But vitamin supplementation is only one piece of a much larger puzzle. Research from Johns Hopkins indicates that lifestyle factors, nutrition, exercise, stress management, and sleep quality all influence arterial health. You could take every vitamin on the shelf, but if you're still eating processed foods, sitting all day, and sleeping 4 hours a night, you're working against yourself. The vitamins might help, but they work best when your body is in a position to use them effectively. Think of it like trying to fill a bucket with holes in it. You need to patch the holes first, which means addressing the fundamental lifestyle factors that contribute to arterial damage. Here's something that might change how you think about this entire topic. The University of Washington conducted research examining what they called the arterial aging process. They found that some people's arteries aged faster than others, and this accelerated aging was associated with specific nutritional deficiencies, inflammatory markers, and metabolic patterns. When these factors were addressed through a comprehensive approach that included targeted nutrition, the rate of arterial aging appeared to slow in some participants. This suggests that the goal isn't just unclogging arteries, it's preventing future buildup by creating an internal environment where plaque is less likely to form in the first place. Now, I want to be clear about something important. The research on vitamins and arterial health is promising, but it's not a guarantee, and it's definitely not a replacement for medical care. If you have diagnosed heart disease or significant arterial blockage, you need to work closely with your healthcare provider. These vitamins may complement conventional treatment, and some doctors are increasingly open to integrative approaches that combine medication with targeted nutritional support. The key word there is alongside, not instead of. Harvard researchers emphasize that cardiovascular health requires a multifaceted approach, and vitamins are one tool in a larger toolkit. So, where does this leave you? If you're over 60 and concerned about your arterial health, the first step is getting proper testing. Ask your doctor about checking your vitamin D levels, magnesium status, and overall cardiovascular markers. Many people walking around are deficient in one or more of these nutrients without knowing it. Once you know where you stand, You can make informed decisions about supplementation as part of a broader health plan. Look for high-quality supplements with the right forms of these vitamins: K2 as MK7, natural vitamin E, vitamin D3 rather than D2, and chelated forms of magnesium like glycinate or threonate. Quality matters because not all supplements are created equal, and some barely contain what their labels claim. Remember, arterial health isn't just about avoiding a heart attack. It's about maintaining the circulation that feeds every cell in your body, including your brain. Research links poor arterial health with cognitive decline, reduced energy, and accelerated aging throughout your entire system. When you take steps to support your cardiovascular system, you're investing in your quality of life for years to come. And the vitamins we've discussed, K2, magnesium, vitamin D, and vitamin E, may offer support when used appropriately alongside medical guidance and healthy lifestyle choices. They're not magic bullets, but they represent tools that research suggests could make a meaningful difference in how your arteries age and function. That's information worth having as you work with your healthcare team to create a plan that's right for your individual situation. Now, if you are really serious about changing your health direction, watch the video in the upper right of your screen. It may be the most important video you watch this year.